the couch. It's nice cool weather out.
Hello. So I'm back again, and I'm actually doing a disability video. I've been wanting to get back into doing disability videos for a while now, but I've been snowed under with work and the disability which I have. What a surprise. So here's the plan. I've got 3 days of hospital visits to do tomorrow and the upcoming days, and I'm going to try and take you along with me. I don't particularly like filming in doctor's appointments, but I will film just before and I'll film just after and tell you about the experience. And the reason why is because I'm doing the tests which you do when you first get diagnosed or are about to get diagnosed with PoTs. So I'm doing the tilt table test, I'm doing a 24-hour blood pressure and heart rate monitor test, and then I'm doing a moderated exercise test, and all of this is to determine my PoTs diagnosis. Now, I've been diagnosed for quite a while, but the last time I did these tests was 2015. That was a while ago. That was in fact 5 years ago. So we need to create a new baseline before going forward. But I thought I'd talk to you about the experience, answer any questions that I think you might have, and just bring you along for the ride. Going to hospital can be scary, but once you get used to it, it's actually pretty easy. So I hope you enjoy this video and you get something from it. So let's go. I love London so much. Oh, I feel like shit, and I am shit. It's in the morning and I'm going to Queen Square Hospital to do the first day of testing, and this will be the heart rate and blood pressure monitor test. And I've done this so many times now. This is not the one I'm worried about, but this is the hospital. It's really nice. It's gonna be normal, really. I'll let you know how it goes and show you the device. Alas, I cannot take the stairs. F for respect. Okay, so I'm back from the hospital, and as you can see, I've got a pressure cuff on. And the way this works is you have, one second, the pressure cuff is on your arm with the arrow pointing down towards the center of your arm, and the cable points up. This is very hard to do. And then you have the cable under your shirt. It runs around the back of your neck and goes down into the control box, which you don't really control a lot of. What you do is it has the time on it and a manual button, which is this blue button, and you can manually enter the time, but it also takes readings every 20 minutes, which is more frequent than I've ever done before. Usually I've done it every 30 minutes. But what they ask you to do is they ask you to have a diary. What it is that you have several sections. The first section is manual recordings taken with activities. Also, do you like my blue swatches? I do. I'm trying to find a good eyeliner. So for example, any time in the morning, stand still and press the blue button and take a recording. Keep standing until the recording is finished. And then you put in the time and you put in any symptoms that you feel. Immediately afterwards, perform an activity that normally provokes your symptoms. Then stand still and take a recording. And basically there's like running recordings, there's laying recordings, there's standing, there's walking, there's stairs. And they try and read everything to see what is actually going on in your body. And then you have the recordings for taking any drugs. And then you have the recording for every 20 minutes. Now this is new. I have never done this before. Usually I just have the automatic, where it takes the reading, but I only do this section of the fold. This is the first time I've done like a recording every single time I have a reading done every 20 minutes. And if you can't write it down, you're running outside, just make sure you check the time on the box and then you write it down on your phone. So for me, I've been writing it down as well on my phone screen, just in case if I'm out and about and walking around or shopping, I can, not miss out. This is not the most attractive thing I've ever worn, but it gets the job done. And so I'll be having this on my actual body for 24 hours. It's annoying. I'm not gonna lie, it's real annoying. But it's important to do if you're trying to get a diagnosis. But what it will do is it beeps during the daytime, and then from 11 o'clock to 8 a.m. it will not beep, but it will take your blood pressure every hour, I think, rather than every 20 minutes. So that's good. But a lot of people don't tend to get a lot of sleep because you have something squeezing your arm every hour. And I have to say, by the time you get through to the evening, your arm starts to hurt. And yet this is not the test which I dislike the most. It's tomorrow. Tomorrow is the tilt table test. And I'll get into that in the next section, but this is the blood pressure and heart rate monitor. Okay, it just beeped. So it's going to start making a noise and tightening my arm. And yeah, this is where it squeezes you. And then the actual device will release the pressure bit by bit like a normal blood pressure monitor. And then it's taken, and it's 11:53, so I write down sitting, and then do I feel any symptoms? Not really, so I'll put NA. But so far I've had gastro pain, no pain, slight pressure in the head, no pain. So that's, it's PoTs life. I know, right? But it's okay, because these things are not too bad. There are worse medical tests out there. And now I'm going to stop wittering on, because it's time. It's just time to stop. I'm on the floor. This is exactly what you wanted to do with chill out time, right?
I'm alright. I'm just here, saying I'm not going to wear too odd shoes for a cosplay.
Thank you. I'm just on the floor. This is attractive. I'm not even timing it. I'm just going to lie here for a little while. So today has been just one pain after another. Woke up in the morning, bad IBS, and then throughout the day IBS has come and gone, but a stupid amount of leg pain. If you don't know, often PoTs people will have hypermobility syndrome. Not hypermobility, but hypermobility syndrome. There's a difference. And it's basically when there's a lack of collagen in your body and your joints and your ligaments. And it means everything's a bit weaker than it should have been. And oh boy, I have such joint pain constantly. It is so nasty. I'm sorry, the light is a bit intense actually, isn't it? Is that better? Let's go with that. So today has just been a nightmare of pain. It has just been ridiculous. Stop that. And I went to class even. And I had to apologise in front of the entire class that I was going to beep and make whirring noises every 20 minutes. So as you can see, I've been getting the stuff signed and putting down every 20 minutes what I've been doing. Walking, same as before. Standing, walking, sitting. On this list, hello. Thank you, I was talking. So, I need to then write down what I'm doing now. I'm talking on the vlog to my lovely followers. Thank you. What time is it? It is 20:33. As I was saying, here's a list of things I've experienced within 3 o'clock to 20 o'clock. Nauseous, gastro pain, same as before. Very bad pain in legs, mainly the knees. Nausea, pain in legs, pain in legs, pain in legs, nauseous, due to heat in the room. The classroom was overheated to the point that when you were outside you felt normal and you walked into the heat. They didn't even open a window and I was just too shy to say, can you please open a fucking window, I'm dying. Because I'm one person. Anyway, pain in the legs, heat making it hard to concentrate, brain fog. Same, no pain. Slightly off from the heat of the room. Same, some stomach pain. Shall we go over on the previous page? Gastro pain, plus warm. Gastro pain, no pain. No pain. Slight pressure in the head. Nothing. Fatigue, plus pain in legs. Nothing. Same. Slightly lightheaded. It's only when I start writing down what I'm feeling in my body at a certain time do I realise that actually my life is filled with symptoms. Honestly, it's filled with them. And sometimes I don't think I realise the fact that I'm constantly feeling something because I've drowned it out over the years. If you have a chronic condition like mine, which has been going on for many years, you kind of get used to it. And so you don't think it's anything out of the ordinary when something goes wrong. But today's been decent. I'm gonna try and keep you updated with tomorrow. We'll see. Tomorrow's the one that's gonna make me sick. Have a good night, because I'm gonna eat some Mr. Kipling fairy cakes and probably watch real estate TV, because that's just what's on TV and there's nothing else, and I just don't like the TV thing, and oh my god, I'm gonna stop talking right now. So I need to get in the shower because I'm sure I look nasty, but I thought I'd film now before I just get into bed and never move again. I didn't manage to film today, both before the appointment and after the appointment. I knew I would have issues today. To explain, the tilt table test is a 2-hour extravaganza where they're testing your autonomic system and your heart rate, and they're trying to use triggers that PoTs people have issues with to literally make you ill so they can then monitor how your body is responding to it. It's not as bad as it sounds, but it does make you feel a little bit like uneasy, makes you feel a little bit sick. You know, it just doesn't make you feel good, but neither does it cause you pain. They're not forcing you to experience pain. And if at any point you're like, I can't do this, they will stop. They're not being like, it's the NHS, so you have to do this, otherwise you're cancelled. No, they're not. They don't do that. But I thought I'd explain to you how it works. So you go in, and there's often the main person and then maybe a trainee, and they'll run through a set list of questions about your symptoms, usually what you experience, how bad it is, that sort of thing. And then they will start off by establishing a baseline. They do this by having you lie down for like 5 minutes, and they take your blood pressure and heart rate every 3 minutes. Once they've established a baseline for what your resting BP is when lying down, they'll get you to stand up, and they'll do the same when you're standing. So again, another baseline. And then what they'll do is they'll start attaching stuff to you while lying down on the bed. So you'll have the blood pressure and heart rate monitor here. You'll have 2 electrodes type things on your chest, which are put on via sticky things, and they monitor heart rate, and you have 1 on your ankle as well. You also have on your non-dominant hand, you've got a heart rate monitor, and this does feel a little bit weird. It's connected to your finger. there's a big blocky instrument on your wrist and then a tether on your shoulder. And all it does is it feels like there's a very small electric current running through the tip of your finger, and it will make your fingertip turn purple. It does feel a bit odd, but you get used to it. Like within 5 minutes, you won't even notice it's happening. So we started off with that, and we needed to start doing tests. So the first test was the one which a lot of people find the hardest. They give you something to squeeze, and you have to squeeze it for 3 minutes. Now, obviously, if you're continuously squeezing, your hand starts to hurt, it starts to tense up, and if you're a PoTs person, everything starts to go haywire because you're expending energy by doing this. But again, if you can't keep it going, they'll just, you can stop. They'll try and get the readings. But you're doing all of this laying down. Next, they get you to do some deep breathing. Again, they monitor how you're reacting to that. I get dizzy from deep breathing, who would have guessed? And then the next one after that they did was some arithmetic. Now, I'm so dyslexic and dyscalculic that I was a complete mess. I couldn't even take away sevens because that's what they were asking me to do, is like, please subtract by 7. I couldn't do it. I kept forgetting that 90s and 80s were numbers. I kept going from like 81 to 79, that kind of thing. I kept missing out the zeros. But I explained, like, I'm dyscalculic as heck, but you guys want me to be confused and puzzled and trying to work out math, I shall definitely do that for you, because that was my entire education. They were lovely about it. All they want to do is test, like, you thinking and how your body responds to you thinking. The next one after that was the one which I hate the most. They will, PoTs people react to heat, and we react to changes in temperature. So what they did is they have an ice pack, and they put your hand in the ice pack. Now, of course, if you don't want to do this, you cannot do it. You don't have to do it. But they ask you to try and keep your hand in it for a minute. That's like the longest minute ever, because having your hand in an ice pack really hurts. It hurts so much, and then it goes past hurting and just goes into the realm of, my hand is thrumming for some odd reason. It's going like. Then we did another breath exercise where they get you to try and blow into a tube and keep it up for a few seconds. And you they try and make it so that, like, if you're blowing up a balloon, you keep the pressure in your chest, so that kind of thing. Again, they measure, they take your blood pressure throughout all of this, they're constantly checking. Then after that we did some hyperventilation exercises. I actually had to stop with that one because I got too dizzy, because if you're kind of going again and again but like really doing it, you get really dizzy, and if you're a PoTs person, you get more dizzy. Too much. It's just too much for the body. What else? I think that's all of the tests we did lying down. I'm pretty sure. I can't think we're missing any. Now what they do is, some people might not like this, is while you are laying down, they will sort out a it's not catheter. What's the word like it? Yes, blood cannula. So what this is it's a small needle going into your arm, right about here, but it's kept in, and they'll sticky tape over where the needle is, so nothing's going to move around. You're not going to have it being tugged on. There's a little cable, and on one, it splits into two. On one, they take the blood, and then they can turn the tap, and on the other side, they can push in a bit of saline solution into your bloodstream. Now, they did this 3 times, where they gave me saline. I don't like it because you can feel the cold in your arm, and you can also taste it in your mouth, because obviously it's rushing around your blood system pretty fast. Not my favourite thing, but also it's not bad, it's just not my fave. So they take the blood, they allow you to calm down, and the reason why they're taking the blood is they're actually measuring your adrenaline in your blood. So I think it's something like capulets or something like that, the actual medical name for it. Either way, they do that, And then this is when they're going to tilt the table. So they very gently strap you down. Obviously your hands are free. They strap you at the stomach and at the knees just to make sure you don't fall out forwards. And they'll tilt you on the table up to a 60-degree angle. So you're still kind of leaning back. And then they'll keep checking on you. They're in the room with you. They never leave you. But they want to see if you can get to 40 minutes, I think. I can always only get to 30 minutes. Every time. I can't do more than 30. Because at 30 minutes of complete standing still, I feel nauseous, so sick, lightheaded, and anything past that, I just think I'm gonna throw up on them, and I don't want that happening. So I always call it, I've always had to call it quits before the actual time is done. They'll take some more blood while you standing up, again, measuring your adrenaline. And then they'll lie you back down and you can just take your time getting back up, getting situated, putting your socks back on. They'll give you a warm blanket if you need it. You know, they're really good. They're not here to hurt you. They're here just to see what's going on. But all of this makes you feel tired, makes you feel a little bit sick. So the rest of the day was spent, you know, not doing the best, but better than I did last time I had this 5 years ago. 5 years ago, I almost just passed out on the train. And then tomorrow is the modified exercise test. So I'm back in again at 3:30. I'll try and take you guys along for the ride. And again, I wish I could film in the hospital, but I did check and there's a no filming policy, like no cameras, no filming, like obvious reasons. It's a hospital. It's not there for your, like, my enjoyment, you know, that kind of thing. And these are people working and doing their jobs. So I hope you've that's day 2, and now we're on to day 3, and then I'll be done. Anyway, I'm gonna go have a shower because I'm nasty.
It's day 3, isn't it, Noctis? Yeah.
It's day 3.
Okay, right. Might be a bit loud, not entirely sure. Just come from hospital, last day of testing, which is always good, always fun. I enjoy the no more testing elements of life. And now I'm actually running to class because testing ended about an hour later than it should have done. And as a result, I'm now had like 20 minutes to get some food down my gob, and now I'm going to class, so rip. Press F to pay respects in the comment section, yeah? So I'm going to go to class. I'll tell you more about it when I get home later tonight. Until then, goodbye.
Wow, I look dead. So, also what's fun? The cuff left me with a rash. Great. It's just because you have plastic surrounding your arm for like 24 hours and I've got sensitive skin. Anyway, I finished all the testing. Today was something called this, because I can't remember it right now. And it actually was real easy. All I had to do was go in, take 3 blood pressure readings lying down, 3 or 4 standing up to get the baseline, and then all you do is you're in this like bed that has a machine attached to it with like a bicycle set up for your legs. You just lift your legs up and you start pedaling, and you do that for like 10 minutes. It's not even that long. It's hard because obviously you're not healthy. The reason why you're doing this test is something's wrong, but it's not bad. And then they take your test, they take your blood pressure, all that jazz, and then they let your feet down and they let you calm down for 10 minutes, and then you're good to go on your way. That one was so easy. There was no pain or discomfort, just a bit of energy, like working out. So yeah, I'm really, really happy with how it all went. I did 3 days of testing and I managed to go to university on both days. I'm so proud of myself because this doesn't happen naturally. Usually it's sort of, you know, I get ill and then I just don't go to class because everything gets a bit too hard. Anyway, I'm sorry I couldn't film as much as I actually wanted to in the hospital. No filming allowed, all that jazz. But I hopefully have found some nice photos to show you what I was doing, and the explanation will be enough. I'm hoping that, you know, this can help someone out there. And if you're watching it and you're like, I have to do this test in like maybe a month, or like even like I've got this test tomorrow, oh my god, I'm so anxious, I don't know what it's going to involve. I'm hoping that just me talking about it will help you, like, just be chill. It's really not too bad, you can do it easily, and they're not there, the doctors are not there to hurt you, they're here to help you. So if you've got any concerns, like, just express it first thing. They'll be so chill with you. Anyway, I'm knackered, absolutely dishwashed, completely capoodled, and all those other very English sounding sayings. I'm gonna go to bed now because I'm tired. But I love you.